Hello everybody and welcome to the Thursday edition of Video Clips, and I have a special treat for you today. A couple weeks ago I think we showed a video of our physical therapy guru, Ms. Eileen Kopsaftis, who is the best in the business. I mean, our business partners are the best in the business. That's what makes me so excited to show up at work every day, because of the enormous talent we've managed to gather into this company. Well, Eileen is based in upstate New York, and I met her when she enrolled for classes here and learned all about what she does and her area of expertise. And there's never been anybody as effective as she is for fixing musculoskeletal injuries. So last time we covered knees, which are a common source of irritation. Today, Eileen is going to show you in a short video how to prevent and address shoulder pain. So knees and shoulders, two areas where people commonly experience pain, and also areas in which people commonly have surgery, which is not such a fabulous idea. So watch what Eileen has to say about this, and I would suggest that you follow her lead instead of having surgery or taking drugs for pain. Here's Eileen.
Hi everybody, my name is Eileen Kopsaftis. I'm a physical therapist, and I have partnered with Wellness Form Health in order to bring you lots of really good information on how to get yourselves out of pain. So the topic for today is shoulder pain. Now, you may be surprised to learn that very often when you have shoulder pain, the biggest reason you have it has nothing to do with your shoulder. And so that being said, if you're being treated for shoulder pain and they're doing everything under the sun to treat that pain and it's not resolving, it's probably because it's not your shoulder. For instance, you might be getting injections, you might be having cold packs, ice, heat, you may be getting some conventional physical therapy, range of motion, stretching, strengthening, and your pain just really isn't going away, or maybe you're getting some temporary relief, but then it's coming back. So I'm going to explain some of the reasons why this particular issue may not be resolving for you. So I'm going to do a little bit of anatomy, and so what I'm going to do is I'm going to turn around and show you that you have a triangle-shaped bone at the bottom of your spine. It's called your sacrum, the point being the tailbone. The base of the sacrum, because a triangle base is the bottom and it's flipped upside down on the body, the base of the sacrum is where your spine meets. That's your LS junction, your lumbosacral junction. Now, that sacrum needs to move opposite of your spine. It's a reciprocal motion. So if I bend backward, my sacrum bends forward. If I bend forward, my sacrum bends backward. If I rotate right, the sacrum rotates left, and so on. So if that reciprocal motion is not happening because there's something going on, maybe you had a small fender bender, maybe you jumped out of a truck and landed on one foot harder than the other, maybe you went to pick up a suitcase and it was heavier than you thought and something got strained. Could be a sports injury, could be an illness, some kind of a disease process that keeps your muscles from working correctly. A lot of medications will affect muscle function and joints. So the bottom line is, if there's something going on in your sacrum, that will affect your shoulder. So if that sacrum is torqued, it will pull on a particular muscle called the latissimus dorsi. And for those of you who don't know a lot about anatomy, that's that muscle that comes up around the side of the back. And it's sort of those guys with the big muscles, they sort of look like cobras right there. That's the lat dorsi. It comes up and attaches to the front of the humeral head, which is the top of the arm bone. When that muscle gets pulled, because the sacrum is pulling on it, it originates in front of the base of the sacrum. So if the sacrum is torqued, it pulls on the muscle. When a muscle gets pulled on, it pulls back. It creates this low-level tug of war. It's kind of like a low-level spasm. You won't even know it's happening, and it could be happening for years, decades even. So what it's going to do is it's going to depress the humeral head. It's going to pull the shoulder out of alignment. Now, it gets depressed. It doesn't need Prozac. We all know about those issues, right? So what happens is it'll pull it out of alignment, and whenever you go to use your arm, it's out of alignment. So if you're treating your shoulder and you're doing exercises, what are you doing? You're putting more miles on a tire that's out of alignment. And what happens to the tire, right? So what you need to do is you need to correct the alignment first before you do therapeutic exercise. There's a very simple technique out there. It's called muscle energy technique. It's one of my favorites. It works beautifully for this kind of a thing. So it's a very simple positioning technique, a very gentle contraction that you will do. Your muscles literally will realign the sacrum. Now the mechanics will be correct. Now, the lat dorsi is still in a little bit of a low-level spasm. So what we need to do is a technique called strain and counter strain. It was developed by Bob Jones decades ago. And all you need to do is shorten the position of that muscle as much as you can. And when you do that, you hold it for 90 seconds. It's passive, so you can't do it to yourself. Someone needs to do it to you. You relax that muscle, it calms down, the spasm stops. Now you have full abduction with no pain. And I've seen this happen with patients, I can't even tell you how many times. Say they're lying on the table and you go to abduct the arm and they can come to maybe here and they have a lot of pain. I correct the sacral alignment and the mechanics. I calm down the lat dorsi, and now the arm is right up to here. As a matter of fact, I did that with a woman this morning, and she's in her 70s, and you should have seen her eyes bug out because her arm went all the way up. So the point is, you have to fix the problem. Now I've got pain-free range of motion. Now I can start to strengthen and restore the function in that arm because the alignment is correct. So don't beat up the victim. Don't go after the shoulder. You're not a shoulder that walks through the door. You're an entire body. So whoever's working with you, your physical therapist, your massage therapist, an osteopath, anyone, they need to understand that you are an entire body. You are not a joint that walks through the door. And you need to find the cause of the problem and not beat up the victim. So I hope this helps, and we'll see you next time.